Hi all, myself Mushida Yasmin, Assistant Professor from SNS College of Physiotherapy. Here I have a group of students who are doing final year in Bachelor of Physiotherapy. So I am going to explain about a case of severe facial palsy for the students, and I will ask questions and will get the responses from how they understood about this case. So students, this is a severe facial palsy case. So in case of facial palsy, the severe cases are rare, and usually the facial palsy itself is a rare case. So let me explain about the presentation and all, and I'll ask you some questions and you answer me whichever is appropriate for you. Okay. So this case name is Mr. Ramesh, 45-year-old male, is working as a school teacher and he is a married person. This case referred to me from a ENT specialist. So what can be a classic presenting symptom of severe facial palsy when you see?
Difficulty in speech.
Yes, difficulty in speech will be there.
Facial asymmetry.
Yes, facial asymmetry will be the classic symptom. Next.
Drooping of mouth.
Yes, drooping of the mouth. So when you are seeing a person with the drooping of the mouth and the facial asymmetry when compared to the other side and the difficulty in speech, we can come to a conclusion that it can be a facial palsy case. So in this case, he was presenting to me with the complaint of sudden onset of inability to move the right side of the face since 2 days. Then drooping of the mouth was noted on the right side and he was unable to close the right eye completely. There is a partial closure of the eye only. Then loss of taste he was sensing in the anterior two-third of the tongue. Next he said, when he was talking to me, he said there is a difficulty in speech, and I also noted that the articulation is not properly done during the speaking, and there was some drooling of the saliva when he was continuously talking to me. So I came to a conclusion that it is a facial palsy, and after examination only there I concluded a severe facial palsy is there. Okay. So when I was taking the history of his present illness, so he was reported to me by waking up with the facial asymmetry 2 days back. He was sleeping normally and he went to bed normally. Suddenly when he wake up in the morning, he noticed the facial asymmetry. He initially thought it was a temporary, but after the day passed, the symptom got worsened. So that include watering of the right eye continuously, and when he was eating, he couldn't able to swallow the food completely. There was a food present in the right side of the cheek, not completely. He was not able to swallow because of the weakness. So then, on examining the history of any medical illness, he didn't had any kind of trauma or any kind of infection, and it is not included in a stroke-like symptom. Okay, so there was no specific limb weakness and there was no loss of consciousness, and all the limb were okay. He was able to do all this work with the complete endurance, but only the face muscles got affected. Okay. So what could be the reason his present medical history with the no history of diabetes, no history of hypertension, no previous neurological illness, no episodes of the viral infection? So what do you think can be the history for this?
Due to any climate change?
Yes, climate change. Which climate will trigger the facial palsy?
Travel to the hill station.
Yes, travel to the hill station, there will be a chill climate. So that can affect the facial nerve suddenly by paralyzing the facial nerve. So that can be the symptom of that. Then next, during physical examination, on observation, I observed the typical classic features of the facial palsy everywhere in the face. Okay, so typically the nasolabial fold that got flattened. There was no fold because of the unintact nerves. Then the corner of the mouth got deviated to the left side. And when I asked the person to blow the cheek by doing like this, the person can't able to do that because he couldn't able to purse the lip. So the lip pursing need both the side of the muscle has to go, but one side if it is not working properly in the sense, he couldn't able to blow the mouth. When he tried to do that, he can able to purse one side of the lip, but the other side couldn't able to purse. Okay. So an incomplete closure of the eye. So incomplete closure of the eye is also known as lag ophthalmos. Lag ophthalmos. So the word implies incomplete closure of the eye. Okay. So muscle, the normal tone on the left side was felt, but on the right side, flaccid tone was there. The tone is not proper to keep the muscle intact. So the next is on during the motor examination, we have to check the muscles of face. Okay. So any one muscle of the face, do you answer? Yes, corrugator superciliary. Any other muscle? Buccinator. Yes, frontalis, orbicularis oculi, zygomaticus major, orbicularis oris, buccinator. These are the muscles primarily which we need to test. Okay. So to test the frontalis, we have to ask the eyebrows to raise. So let me ask any one of you to be as a model to act and show the assessment part of this muscle testing. Okay. So anyone please come as a model. Yes. So to test the frontalis muscle, it is present here. Okay. So we have to ask the patient to raise the eyebrows. Can you please raise the eyebrows? Yes, if the person can able to completely raise the eyebrow, the muscle is intact. But in this case, during this examination, according to manual muscle grading, MRC grade, so this frontalis muscle grade is 0. The person couldn't able to raise the eyebrow. Okay. So the next is orbicularis oculi. Close the eyes tightly. Yes. So this is how we have to check the orbicularis oculi. So on examining this, the MRC grade for this person is 1/5. Okay. So the next zygomatic major. Ask the patient to smile. Do a mild smile. Yes. The person can able to smile. So in that person, when I was examining, the grade is 1/5. The person couldn't able to smile. Okay. So the next is orbicularis oris. Pucker of the lip. Which is called as pucker of the lip. So we have to ask the patient to purse the lip. Okay. So purse the lip. Pursed lip breathing we will do, right? So like that we have to ask. Okay. So in that case, the person which I saw had the grading of 1/5. Next to buccinator, we have to ask the patient muscle. We have to ask the patient to blow the cheek with the air. If the person can able to do that, is a good buccinator works. In my case, the patient couldn't able to fill the air even. So it was 1/5 only. So this is how we have to check the facial muscle assessment. So thank you for the cooperation. So you can go to your seat. Next, let me discuss about physiotherapy management. So our role is to completely cure the symptoms and get back the facial muscles work like previous one. So in the physiotherapy management, I have followed a short-term and long-term goal setting. Short-term goal I fixed for the 2 weeks protocol. Long-term goal I fixed for 4 to 8 weeks protocol. Right? So in the short-term goal, so I stated only 3 things in the short-term goal. I have to prevent the muscle wasting to the further level. Thereby I will prevent the muscle atrophy. Next I have to protect the cornea. Since there is a loss of moisture, the cornea can affect easily because of the continuous watery structure in the eye that will affect the cornea. So I have to prevent the cornea, then I have to reduce the inflammation and nerve irritation. That is my primary goal. Then in my long-term goal, I have to restore the facial muscle function and the coordination of the muscle also, and I have to improve the symmetry of the muscle during voluntary working. Thereby, I will give him a return back to normal activities and social participation. Since the facial muscle or the generally when we look a person and we talk to them, we will see the facial muscles only. So when the face looks awkward, the social participation of the person will get restricted. There will be a loss of self-confidence. So by restoring all those things, I will get him back to a social participation. For that, I have prepared an acute phase protocol, recovery phase protocol, functional phase protocol. So in this, today I will discuss about the acute phase protocol. So in acute phase protocol, the day when I visited the case to a 2 weeks of the duration. Okay. So I will give a eye care, eye patching at the night, then electrical stimulation is the best thing you can do with the severe facial nerve palsy. So on the affected muscle, we'll give a Faraday current because the nerve is intact. So we can use Faraday current. So low frequency Faraday current can be given to the person. And gentle massage, upward stroking of the facial muscles will give them a sensory stimulus, as well as the massage will give you a good blood circulation. That way the muscles will rejuvenate. Okay. Then facial exercises. So primary facial exercises we have to concentrate is eyebrow lifting exercise, eye closing with assistance, opening with the resistance, and blowing of the cheek with the hand support, and smiling activity with the help of mirror therapy. The mirror therapy is the good therapy for the facial palsy cases. So in that case, the mirror therapy works well. Okay. So in recovery cases, we can progress from active assisted to the very active one. And in functional cases, functional phase of the activity, we can incorporate all the activities with the functional tasks like brushing and like doing all the activities with the face and blowing and asking the person to do blowing with the balloon filling. These kind of activities we can incorporate. So in case in future you are getting out of your curriculum and you are going to enter into your real time of dealing with the patients, in case if you see a severe facial palsy, first you have to assess and come to a state whether it is acute, subacute or severe cases. And according to that, plan short term and long term goal, then progress easily with the next step of the treatment protocol. Are you all clear about it? Do you have any doubt in this? Yes. Okay. Thank you for your cooperation, students. Thank you.